helpful to people. So I decided to put together a small, simple presentation that talks about health. And we all have heard this from kindergarten onwards, that health is wealth. And that is true. And if you look at medicine or health as the biggest asset that we can have as human beings, as living beings, if we can say to ourselves that if our health is everything we have, then we will really focus on ourselves, because it allows us to succeed in every aspect of life, because a healthy body, a healthy mind all works together. And this is being taught from kindergarten to every child in the world. So this is a universal, global fact. So, next slide. So my goal is to try and give you guys a general brief guideline, and I'm going to go over some slides quickly, but I will be able to elaborate more. When we talk about success, we talk about a peace of mind, which is coming from satisfaction that we do the best for ourselves because we are wanting to be the best. So success becomes an attitude. Choosing the right attitude towards your health makes you wealthy. It's a very simple concept. Next slide. So how do you improve your life with simple daily steps? I am a physician, and we have been told and trained to talk about medicine and disease and pathology and surgeries and how do we take care of our patients. But as a doctor, I believe the first thing that every physician should be talking about is diet and exercise. I would like you all to go to your physicians, whoever you say, and ask them, implore them to concentrate on diet and exercise. Teach you, understand, educate you guys about what you can do. And in doing that, you will realize that a lot of our medical problems are due to our immunity being low. And boosting that immunity with simple solutions is very important. And I'm going to be touching on some of these ideas that how do you boost immunity. Fiber is a big deal. Okay, it's a prebiotic, probiotic, and others like honey, yogurt, etc. can help. Exercise is huge. Walking is huge. Taking a 5-minute time break so you can start doing some like a sort of like a stretching exercise or breathing exercise for personal time is important. I recommend the 5 Tibetan rites. I've been doing this for about 2 years now, and I find this to be a very easy universal exercise plan that doesn't require any kind of philosophy, any kind of ideology. It is just a simple 5-step regimental program. Get educated about what you can do to improve your life. Supplements of some kinds can help. And we're going to touch about how CBD and endocannabinoid system can help you with that. Next slide. So if I could give every person on this planet one tip before I die, if I could tell them that, look, one thing that I've learned through my education, my time on this planet, it would be that we should eat more fiber. Why is that important? Fiber acts like a scrubber for the colon. We've all seen baby bottles that have ridges inside and you need a brush to clean the baby bottle. Yes, the colon has ridges on the inside, and stool gets stuck in those areas. You get diverticulosis, you get pockets, you get other areas. Just like a bottle brush, you have a baby bottle, you want to clean it. Same thing with the fiber. cellulose, that is non-absorbed, non-digested fiber, acts like a mechanical brush, cleans out the colon as the food goes through. What it does is that it gets rid of all the toxic byproducts that are formed, and in also eradicates the dead tissue, bacteria, and everything else that is formed every day, and it cleans it out. The way I like to tell everybody about the colon is that think of it as a layer of skin on your body. The skin is going from your skin inside, it is extending into your mouth, all the way into your mouth, your food pipe. There's an internal lining through your anus. So you have an internal lining that is protecting you from the environment. So if you eat something, that has to penetrate the internal skin barrier. Just like we have the skin on our hand and something has to penetrate through it, food has to penetrate through the internal skin lining and then get into our blood and to our tissues. So keeping our skin healthy is important, yeah? We all want to look pretty, we all do all kinds of things for it. Same thing about our gut. Our gut needs to be kept clean and scrubbed, just like a loofah does. Just like we use soap, we use other products, fiber is huge. Then, secondly, our gut has bacteria inside, trillions of them, fungi, virus, protozoans. All of these create a microbacterial universe all around us. And this universe, if I can stand, goes about 6 feet all around us. There is a cloud of bacteria, viruses, fungi that are around us and that are inside us, that are on our skin, in our eyes, in our ears, on our hair, inside our mouth, or in our anus, in the stomach, in the colon. In the colon, we have trillions of bacteria which help to break down the food. And that is called the gut microbiome. In the last 20 years, we have learned so much about the microbiome. This word microbiome means is the universe that lives inside each individual. And each individual has a slightly different gut bacterial biome. So just like we have DNA, we have fingerprinting, your biome is unique to you. It's unique to family members. It's unique to children, parents, everybody. So what they have found out that the gut bacterial biome can change with what you eat. If you add more fiber, the fiber cellulose goes inside the colon, it gets fermented, and during the process of fermenting, the digestion of carbohydrates causes the breakdown at cellular level, and we make short chain fatty acids and various gases and other products. The colonic lining, which looks like this, if I could show you, inside the colonic lining is very, very thin, this white line, okay? The pink line is the muscle, and the outside lining is the rest of the body. So food needs to travel from the inside to outside our bodies. And in doing so, it travels through this lining. So in doing that, the short chain fatty acids are the food for the lining of individual cells. So we provide nourishment to our gut, our colon, by eating our food. And that food breaks down into byproducts. These short chain fatty acids are healing the colon every day. So if you do not eat fiber, you're not healing your gut, and you're going to have problems. My favorite recommendation, and I will tell you that having been a surgeon for 20 years, I've treated thousands of patients, and I have recommended ground flaxseed powder, which I personally take. I recommend it to my family members and patients, and I have thousands of patients who come back and tell me, doctor, that thing has changed my life. It is a simple thing to do. Everybody talks about fiber. How do you take it? Blah, blah, blah. There's hundreds of things to take. Gummies, candies, bananas, avocados, nuts. Nobody knows. Adding a supplement, ground up flaxseed, you add 1 or 2 tablespoons a day to your food. You do that, you will immediately in the next 24 to 48 hours start to see your bowel function improve. And that is going to be a healthy thing. Why is that healthy? The fiber removes the cholesterol that we make in the liver. That is the single most important reason why American Heart Association has a stamp on the Cheerios box. It says Cheerios reduce cholesterol. Yes, we've all tried it. Kellogg's paid a lot of money to American Heart Association. But the reason for that is that we know that cereal also contains some fiber. We are recommending that you need about 30 to 40 grams of fiber a day. You cannot eat it all with cereal. So you need to have a wholesome diet that has various components in it, various plants that have cellulose that can add the fiber that you need daily. So adding 1 to 2 tablespoons of ground flaxseed is a supplement that should become a daily habit. That's what I think should happen. Why is that important? Because it's a gut feeling. Anything that you eat is causing chemical reactions inside you. Your epinephrine, your serotonin, your dopamine, your gabapentin, all these chemicals that make us smile, that make us laugh, that make us sad, that make us angry, mad. It's all due to food. It's all due to the emotional release of the chemicals that cause all these things. So having a good meal, having chocolate makes everybody smile. Everybody likes ice cream. Okay, that causes a release of serotonin in the body from the liver. So we are all chemical reactions, billions of them happening all the time. And those chemical reactions keep us healthy. And next slide. So talking about how to add food, artichokes, avocados, pears, carrots, walnuts, lentils, quinoa, oats, flax. All of these are healthy opportunities for us to incorporate in our diet. I would like this message to be the most important message I want to give out. Eat more fiber. Next slide. Exercise also, guys. Walking, moving around improves circulation. We all are worried about the COVID virus. Yes, we all want to not get this, so we are going to talk about that. But moving and breathing and making sure that our lungs are opening up, blood circulation is going through, is important, especially because we know that there's a lot of problems that can happen if you don't do that. You can have arthritis, you don't move, you can get all kinds of problems, heart disease, etc. So being healthy, wealthy, and wise means that you need to move a little bit throughout your life. As a sedentary adult human, most Americans are not exercising enough. They need to get out there. Do something in your house, move out 5 minutes of your time every day. Somebody needs to tell and teach this to every person on this planet. That's the biggest thing we need to do. Less food, more fiber, and more exercise. I think we'll heal the world. Next slide. So doing the 5 rights, I would like you guys to go online and Google this. This is a very simple, easy way to extend and stretch your muscles and ligaments. We are sitting down, we don't stand as much, we don't walk as much. So all kinds of postural movements that you can do are allowing our bodies to heal. Next slide. And it can be done at your pace. You don't have to be an athlete to work out. So next topic that we're going to focus on is CBD and why is that important. Next slide. So this is a busy slide. I wanted to just throw it out there that the endocannabinoid system acts as a balancing, how should I say, a balancing act in the body. So just like babies, you have those, a baby's cradle can have those hanging lights and they're all hanging together. And what do you call that thing with the various lights or toys hanging from thing and it can move? Anyways, like a seesaw, if it goes up and down, you got to keep it balanced. So endocannabinoid system works on the body with these chemicals, and next slide will help you understand a little bit more, because the key word is homeostasis. Benefit of CBD, the biggest benefit is it is anti-inflammatory. It also helps in anxiety reduction, acts as anti-nausea effect, gives us some drowsiness and helps with sleep. It has pain relief activity as well as muscle relaxation activity. Next slide. So how does the CBD work? I showed you a slide with homeostasis and endocannabinoid with a guy with a lot of things around it, which didn't make a lot of sense. But what happens is that CB1 and 2 receptors are present on each cell of the body. And they are present in various concentration. In the brain, CB1 receptor is more common. In the gut, CB2 receptor is more common. THC works on CB1 receptor in the brain and makes us happy and high. CB2 receptor is present in the GI tract, where the CBD receptor goes and acts on, and that causes an anti-inflammatory, anti-nausea effect, and we'll talk more about it. Next. So how does the CBD affect on the endocannabinoid system in the body? The endocannabinoid system is a loose communication system in the body which connects together with various chemicals that our neurons are sending out. They help with osteoarthritis, which is inflammation of the bone, inflammation of the GI tract, skin inflammation like dermatitis, acne. Wound healing is affected by CBD. So if you have a cut, you have a surgical scar, you have internal healing, all of that can help. And CBD can also help in cancer immune modulation. This is very important. Next slide. So I like to give everybody an example of what's happening in the gastrointestinal tract so that I can make people understand what is happening in the bone, what is happening in the heart, what is happening in the lung, what is happening everywhere. Because the model is the same. There's an outer layer and then there's an inner layer. The outer layer is the skin, the inner layer touches the internal organs, and in between is this gate, just like our skin is a barrier. This barrier prevents different things from entering. If you have a toxin, food particles, drugs, pathogens, as well as anxiety. All of these things cause various reactions and they cause GI inflammation. Somebody mentioned diverticulitis. Okay, diverticulitis is an inflammation of the colonic lining caused by less fiber, because you haven't been taking fiber all your life, so you get diverticulosis. Then one of the pocket opens up, infection comes out, the lining breaks down, and in between each cell, there is a bond. Each cell on a line is connected by a glue. That glue is called tight junction. And when those tight junctions, the glue opens up, the cells move apart. and molecules can travel. And that is why you get food tolerance, immune system abnormalities, as well as autoimmune osteoarthritis, uveitis, nerve damage, skin damage, bone damage, all kinds of tissues can be affected. Next slide. So a leaky gut is like a sieve. So basically, patients who have that can get serious problems. And that is one of the biggest gateway that causes problems, and things that get into our gut then can go everywhere else in our body. So how does the CBD affect the GI tract? It decreases nausea, increases appetite, makes you hungry, and make you want to feel good. On physiologic basis, it decreases esophageal relaxation, okay, and decreases emptying and allows the digestion to happen in its proper manner. So when I was talking about muscle spasm and what it does in the stomach, it does that. It also decreases motility, so it lessens the diarrhea that can happen with increasing toxic food. It decreases toxic secretions. It improves epithelial wound healing. This is very important. What we have found out that in patients with Crohn's disease, ulcerative colitis, irritable bowel disease, and other autoimmune gastrointestinal diseases, we are seeing the lining heal over time with CBD and THC plant medicine. So we are seeing now that patients are coming with less symptoms. Doctor, my diarrhea has decreased, my bleeding has decreased, my abdominal pain has decreased. I'm eating better. So all of that is not happening magically. We are changing their diet. We are asking them to exercise. We are giving them medicine to make them relax. And that causes a decrease in inflammatory markers and hormones and cells that are going crazy. So that is important for immunity, for T cell and B cell and macrophages. These are all various troops that are lined up in the blood, in the skin, in the liver, in the gallbladder, in the spleen. These are all troops that are there to help fight any disease, virus, pathology, etc. These are activated by CBD and THC. And yes, there is a research being done on COVID-19 also, but it's not being done in America because of CBD and THC being illegal. But in countries like Israel and Argentina and others, they are looking at answers for this, and we are finding some hope. Okay, next slide. So all of this came around because we have oils, we have gummies, we have creams, we have all different ways of ingesting CBD, etc. How is that going to affect your immunity? How is that going to affect us today in the time when everybody's asking what to do? So I wanted to take this time and educate some of our people about why is this pandemic, COVID-19, which being a virus, is so deadly. Why is it so important that we wear a mask? I have been wearing a mask since I joined medical school, and initially it was very hard. I have here some of the ideas that I thought I should talk to you about. So practicing sanitation is so important. You need to wash a hand, need to wash your mouth every time you put something in your mouth. Similarly, because this is an outer lining, it's going through the outer lining inside a mouth. We want to make sure that we can clean it as much. Okay. Practicing safe distance, 6 feet apart or 2 meters. 12 feet apart is what you need for smaller droplets to not get near you. If you are conversing with any human that is not close to your biome, meaning they're not living with you, we haven't shared the same cross-contaminants, you're at risk for getting diseases like COVID-19. And what we have found out, too late, I believe, or it has been there in the medical field, but the public has not been educated, is that masking is very important. okay? This is a universal thing. When we were kids, we were taught you have a cough, you cover your face. You sneeze, you cover your face. Why is that? Because we threw out droplets. And those droplets have stuff in them, whether they're parasites, bacteria, viruses, fungi, they're all there, okay? So for the common public who is asymptomatic, having no problems, going about their day, a cloth covering or a cloth or cotton paper covering is adequate, because what you're doing is you are preventing the droplets that you are spewing out from going to somebody else. When a doctor wears a mask in an operating room, our biggest role is to prevent our bacteria from infecting the patient. I'm cutting a patient, I'm exposing the inside, which is sterile. And if I cough, if I'm not wearing a mask, if I'm not wearing a glove, I'm going to give that guy infection. Yes? Do you guys agree with that? So why is it that anybody who has COVID-19, who's spewing out viruses, shouldn't be covered? They should be covered, yeah? There's no debate about this. I mean, it has no logic debate. I can't breathe, I can't get carbon dioxide. This is all wrong. Why? Because we're not asking you to wear this kind of mask. This is a N95 mask, which comes in two varieties, this and this. This mask has a valve on the outside. This mask is a valve so that you can filter what's coming in, but when you breathe, you can spew it out. So this kind of N95 mask needs another mask on top of it as a covering mask. This is used for specialized people who are taking care of COVID-19 patients themselves. You in the public are never going to be taking care of COVID-19 patients, yeah? Nobody, except physicians or medical healthcare practitioners. So N95 masks, which are very hard to find and difficult because we don't have a stockpile of them, are still very difficult to find. These are reserved for patients and people who are taking care of them, okay? For the general public and the rest of the world, masking is important. You can use a K95 mask, which is slightly better than the ordinary mask, okay? Or you can just use a cloth mask and paper mask. But please, we need to wear masks. This is not a political issue. This is not a political issue. This is a health issue. Every person, if every person on this planet wore a mask, immediately, one day everybody said, we're all gonna wear a mask, this virus would be over in 2 weeks. Because the half-life of the virus is that. But we're not willing to because we have made it a political deal. It's never been a political deal. Whether you're Republican or Democrat or green or yellow or brown, in the hospital, every doctor wears it, yeah? Every nurse wears it. Because we know there's virus there. Now we know the virus is outside. It's everywhere. So people have to do it right. So what are the common things to take care of? Tell your family members. If they go out, they cannot go out without a mask. If they are within 2 feet of another human being, cover your face, because you are going to give them something or you're going to get something from them. And please don't take a chance. This is not a hoax. Okay, we all know family members and friends who've had this and are suffering. And it's not just, oh, it has a death rate of 1% or 0.1% or 99% of patients are okay. Do you know what it does to the people who get it? They're out for 5 to 6 weeks minimum. They are not able to take care of their families. Another family member has to take care of them. They get long-term effects, cardiac issues. We're going to have pulmonary cripples in this country. Million people who are pulmonary crippled for years to come. Who's going to take care of them? Nobody's talking about the effects of this virus a year from now. We are all like, oh, there's no death. I'm okay. I can go out and party and have a beer, and I don't want to wear a mask because it infringes on my freedom. You go to the airport and you take your shoes off, yeah? Because somebody 20 years ago tried to match. All we need to do is have a government that has the balls to say, we are going to have masks. We did that for 911. We stopped everybody from flying. Why did we do that? Why couldn't we stop everybody from flying for 2 weeks when that happened, and could have stopped everything? But we didn't. Anyways, the more important part is, please, please, please make sure that you guys, this is not going away. This is going to get worse in the months to come. Maintain social distancing. Make sure that you visit a hospital if you really need to. There are doctors that can see you without being seen via telemedicine. Okay, emergency care should only be sought if you really need it. Call your doctor. You can get into a specialist without a referral now. So all of those are opportunities for us to prevent this kind of catastrophe. So this is why I wanted to focus on, basically, we do have a CBD raffle. I know we have 10 people on, and one of you guys, we're going to write your names down, and then one of you guys will get one of these sample packs. This is worth $20, has some CBD oils, has some creams to try. And the goal is to give somebody this so that they can experience something different. Next slide. So our advantage is our doors are open today. Call us and we'll get you in. Simple as that. Thank you, guys. I wanted to leave a simple presentation, so I didn't want to go into a lot. I would like to know if there's any questions that anybody has.